Good morning, everyone. We will present to you our topic about physical and sexual self.
Physical self. It refers to the body, this marvelous container and complex, finely tuned machine with we interface with our environment and fellow beings. It is the concrete dimension, the tangible aspect of the person that can be directly observed and examined. So, ang physical self it is it is what we use to interface to our fellow beings sa itong mga kapwa-tao. Ug mao po ni siya ang diretso na ma-observe sa ubang tao kung unsa ka kataas, kung unsa imong itsura. Physical self-esteem. A person's evaluation of their physical self, including evaluations of both physical appearance and physical competencies, also known as physical self-worth. So, when you have a healthy body image, you can feel comfortable about your body. Og mo po ni also known how to care for it. Murag imong self-worth kung nakay value and respect sa imong kaugalingon, ma ano na ma-affects it affects how you take care of yourself. Physical beauty. It is the degree to which a person's physical traits are considered pleasing or beautiful. A combination of qualities such as shape, color, or form that pleases the aesthetic senses, especially the sight. Mao ni ang mga panan-aw sa tao na kung gwapa pa ka sa ilaha, kung mo ni ang ma-describe nila, wala, imong hair kay short, or imong color, imong skin color kay moreno, ina.
When we say physical beauty, it is a qualities of a person that others can view. It is a qualities of a person that others can see, such as your hair and facial features. And there are three qualities of physical beauty. First is genetic, means how we actually look. For example, if we have a light skin, a brown skin, blue eye, or brown eye. Second is health and grooming. It means how we take care of ourselves. For example, taking good care of our fingernails, hair, and body. Grooming is caring for your body parts. Feeling looking good are important to each individual, emotional and physical well-being. Third is positive self-regard. Positive self-regard, how we feel about how we look. According to Rogers, people have two fundamental psychological needs: positive self-regard and self-actualization. Positive self-regard refers to the need for love, affection, and respect from other people. Rogers concludes that the most people seem to satisfy this need in a reasonable manner. So when we say positive self-regard, it is all about how we feel about how we look. And positive self-regard comes from within. It means gikan jud sa atoa nga idea kung sa tong palantaw sa tong kagalingon dili siya gikan sa uban. And next is perception. It surrounds beauty and body types not only vary by culture but have evolved significantly throughout history up until today, in which women ideal body types are set by society standards of beauty. For example, sa China, ang beauty standard nila is kung putiin ka, taas pud ang imong ilong, taas imong height, og napo kay crop teeth, pasar ka sa ilang standard. So, and another example is sa Philippines. Ang beauty standard sa Philippines is kung kung imong skin is morena, so pasok ka sa anang standard. And ang women po dayon, ang women in another country ga murag ga aim pud sila nga ma-achieve na nila ang ilang body or kana nga beauty para makapasok lang sa standard sa ilahang country. And next is taking good care of ourselves. Ano kinahanglan man nato ati man natong kaugalingon. Or we need to take care of ourselves. Engaging in self-care routine reduce or eliminate anxiety and depression, reduces stress, improve concentration, minimize frustration and anger, increase happiness, and improve energy. So, if we take care of ourselves, maka-avoid jud ta sa depression ug maka-gain pud ta og happiness og energy. So, we need to take care of ourselves mentally and physically. So, taking good care of ourselves, we need to work toward our goals. It means nga kanang we need to seek or to strive para ma-achieve nato ng goals. Second is care for yourself. Third is build connection. One of them is the impact it has on health. Connecting with other people can help with an overall feeling self-worth purpose. It can lower our stress, helps live longer, and decrease our risk of isolation and depression. Lastly is we need to meditate. We need to exercise our mind, and kung mag-meditate po ta, makahatag po ni siya og sense of calm, ease, and balance that can benefit both emotional well-being and your own overall health. In conclusion, taking good care of yourself is important because it can help you to avoid depression or any stress, and it can gain you happiness.
Philosophy psychology view of one's sexual self. Sexual self. What is your sexual self? This part of yourself where you learn and understand your sexual development and how people's sexual activity, beliefs, misconceptions, and unlimited access from the internet on sex can influence your own sexual behavior and responses. Human sexual behavior or human sexual practice is a manner in which humans experience and express their sexuality. Sexual behavior includes a wide variety of activities individuals engage in to express their sexuality. What are the examples of human sexual behavior? Masturbation, oral genital stimulation or oral sex, penile vaginal intercourse or vaginal sex, and anal stimulation or anal intercourse. Physiology of human sexual response. Sexual response follows a pattern of sequential stages or phases when sexual activity is continued. There are four kinds of sexual response. First is excitement phase, second is plateau phase, third is sexual climax, fourth is resolution phase. Excitement phase, these changes include an increase in blood supply to the surface of the body resulting in increase in temperature, flushing and swelling of all distensible body parts, particularly noticeable in the penis and female breast. More rapid breathing, the secretion of genital fluid, vaginal expansion, and a general increase in muscle tension. Plateau phase, which is generally of brief duration. If stimulation is continued, orgasm usually occurs. Sexual climax, or also called orgasm, is defined by a feeling of sudden intense pleasure and an abrupt increase in pulse rate and blood pressure, and spasm of the pelvic muscles causing vaginal contraction in the female and ejaculation by the male. Resolution pace. The body slowly returns to its normal level of functioning and swelled and erect body parts return to the previous size and color.
Next is the psychological aspect of sex. So there are three aspects of sex: the social cultural influence, external stimuli, and internal stimuli. So under the social cultural influence, the family, religion, society, and personal value. So, ga-include ni siya sa imuhang body image, appearance, time and setting, gender culture script, and expectation for pleasure or orgasm. So, next is the external stimuli. So, dire is ang under siya sa movie, TV, magazine, porn, or pornography. Sa kani siya is imuhang kakakita sa mga TV, porn, magazine, sa kasi gakadunggan nimo siya sa or gakita nimo siya sa newspaper. Next is external stimuli. Mo na sad ni siya ang imagination nimo, si imong dreams, imong fantasy, and imuhang memory. Type of behavior. So there are two types of behavior: the solitary and social sexual. So ang solitary is involving only one individual, and there is social sexual activity involving more than one person. Ang social sexual na sad is generally divided into heterosexual activity with male with female and homosexual activity for male with male or female with female. There are two major factors that determine human sexual behavior. First is inherited. So, ang inherited is namana nimo siya sa imong mama or papa, or sa imong lolo, lola, or sa imong mga ninuno. While ang influence is influence imong mga friends, so mga people na nakapalibot sa imuha. Next is terms. So, sexual orientation. It is a relatively enduring physical or romantic attraction to a partner of your own opposite sex or both. So, ang sexual orientation is, gani siya is like, naka-romantic or sexual attraction to a person of opposite sex or gender, for the same sex or gender, or both sexes, or more than one gender. Next is ang heterosexual or opposite sex. Ang heterosexual is attraction or sexual attraction or sexual behavior between people of the opposite sex or gender. Next is homosexual. Ang homosexual is a person who is sexually attracted to people of their own sex, or a person or sexually attracted to people of one own sex. So, before we start, so what is STD or sexually transmitted diseases? So, ang STD or infection spread from one person to another. Usually during ni siya sa mga vaginal, anal, or oral sex. So, daghan nga tao ang naay STD nga wala sila kabalo nga naa sila STD because wala sila gakita nga symptoms. So, kung walay treatment ang STD, pwede siya nga or makalead siya sa serious health problem. So, but the good things that is getting tested is no big deal because ang STD are easily to treat or daghan siya pamaagi para magamot siya. Let's move on to the most common STD. First is the chlamydia. So what is chlamydia? Chlamydia is a common STD that can cause infection among both men and women. it can cause permanent damage to a woman's reproductive system. This can make it difficult or impossible to get pregnant later on. So chlamydia can also cause a potentially fatal ectopic pregnancy or pregnancy that can occur outside the womb. So, ang chlamydia, sa mga babae, if na may mga chlamydia, na ay chances na maglisod mo og anak or dili na mo makaanak because kay ginadaot sa virus ang inyuhang reproductive system. So next is how is chlamydia spread? So you can get chlamydia by having vaginal, anal, or oral sex with someone who has chlamydia. Also, you can still get chlamydia even if your sex partner does not ejaculate or come. So, a pregnant woman or a person with chlamydia can give the infection to their baby during childbirth. So, example, if ikaw like bruise ka or you're pregnant, then you have chlamydia. Pwede nga ang infection is pwede niyo mapasa sa imong unborn child. So next is how do we know if na kay chlamydia? So chlamydia is have no symptoms at all, but it can cause serious health problems even without symptoms. If symptoms occur, they may not appear until several weeks. So, example, nagipag sex ka, dili pa siya like pagkahuman dayon is like nanay symptoms. Like mga several weeks pa ay hani mo siya maka experience ka og mga symptoms. So even when chlamydia has no symptoms, it can damage a woman's reproductive system. So, bisag daw walay symptoms nga ginapakita nga na kay chlamydia na ay chances nga imuhang reproductive system is nadaot na because naalagi nakipag talik lagi ka sa naay chlamydia na your sex partner na chlamydia. So next is women with the symptoms may notice abnormal vaginal discharge and a burning sensation when peeping, or if mangihi ka murag na like bitaw murag na burning sensation. So sa men na sad, ilahang symptoms is discharge from their penis. Next is burning sensation when peeping para sa gyapon sa babae, and pain and swallowing in one or both testicles. Although kani siya is less common. So naabay cure ang chlamydia? Yes, naa. If the right treatment, if ang imong treatment is tama, yes, pwede. Yes, maka-cure siya. It is important that you take all of your medicine your healthcare provider give you to cure your infection. So, if gihatagan kasi mo ang healthcare provider o mga medicine, dapat is inumon nimo siya daily or sabay giingon sa imong healthcare. Dili kay mag-inom ka karon tapos next na sa dili then inom na sad ka. So nay chances nga murag dili gyapon mag-effect tong ginainom nimo nga medicine. So do not share your medicine for chlamydia with anyone. So dili nimo i-share imong medicine sa uban tao. When taken properly, it will stop the infection and could decrease your chances of having problem later. So if giinom nimo ang medicine nimo properly, so naay chances nga ang katong infection will decrease. So, although medicine will stop the infection, it will not undo any permanent damage caused by the disease. So, bisag nag-inom na ka or nawala na tong infection, if katong nanay na damage sa imuha, dili na to siya ma-undo or na siya mabalik. Repeat infection with chlamydia is common. So, kani siya, pwede siya magbalik-balik. So, need yun na to siya nga magpa-check up monthly or every 6 months para mabalaan if basig nagbalik ang ato nga sakit. Next is gonorrhea. So, what is gonorrhea? Gonorrhea is an STD that can cause infection in the genitals, rectum, and throat. It is very common, especially among young people aged 15 to 24 years old. So, ang gonorrhea is very common, especially sa ato nga sa ato ang mga teenager. So, kani siya is halos ay kasagaran ang infection is mahitabo sa genitals, rectum, and sa atong throat. So, how is gonorrhea spread? So, you can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. So, makuha nimo ang gonorrhea by having sex with someone nga naanadaay gonorrhea. So, a pregnant person with gonorrhea can give the infection to their baby during childbirth. So, ang pregnant woman nga nanay STD, pwede nila mapasa ang infection sa ilahang baby. So, next is unsay pagkabalo nato if nanatay gonorrhea. So, first is gonorrhea has no symptoms. So, walay symptoms ang gonorrhea. But it can cause serious health problem even without symptoms. So, bisag wala siya sintomas, pwede siya maka-create og serious health problem. So, most women with gonorrhea do not have any symptoms. So, halos sa mga babae, wala sila ma-experience ng mga symptoms. Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. So, ang symptoms sa woman may include painful or burning sensation when peeping, increased vaginal discharge, and vaginal bleeding between periods. Sa ang menasad is ilahang symptoms is burning sensation when peeping, a white, yellow, or green discharge from their penis, and painful or swollen tentacles. So, nabay cure ang gonorrhea? The answer is yes, naa. The right treatment can cure gonorrhea. It is important that you take all the medicine that your healthcare provider give you to cure infection. Do not share medicine for gonorrhea with anyone. Although medicine will stop the infection, it will not undo any permanent damage caused by the disease. So, murag parehas ra gyapon sila sa chlamydia, like dili dapat ihatag or dili dapat inimo i-share ang imuhang medicine sa uban. Tapos ang infection mag-stop ang infection pero dili na mabalik tung na damage na. So So it is becoming harder to treat some gonorrhea. A drug-resistant strain of gonorrhea are increasing. Return to a healthcare provider if your symptoms continue for more than a few days after receiving treatment. So, ang gonorrhea is like lisod-lisod siya i-treat. So, naay chances nga mo balik-balik ang ang infection. So, you must return to your healthcare provider para sa another check-ups or another diagnostic. So, what is syphilis? Syphilis is a sexually transmitted infection or STI that can cause serious health problems without treatment. Infection develops in stage primary, secondary, latent, and tertiary. Each stage can have different signs and symptoms. So, ang syphilis is if dili siya matreat dali-dali, pwede siya maka-cause of serious health problem. So, ang syphilis have 4 stages. Ang primary, secondary, latent, and tertiary. So, each of the stages have different signs and symptoms. So, how is syphilis spread? So, you can get syphilis by direct contact with syphilis sore during vaginal, anal, or oral sex. So, syphilis can spread from a mother with syphilis to her unborn baby. So, ang syphilis is, example, pregnant ka, tas you have syphilis, then pwede nimo siya mapasa sa imuhang unborn baby. So, makakuha ta og syphilis through casual contact with objects such as toilet seats, doorknobs, swimming pools, hot tubs, sharing clothing, and eating utensil. So, sa toilet seats, so, especially sa mga public, sample sa mga mall or mga park, so dapat mag-ingat ta kung asa ta mag comfort room kay basig dara pa ta makakuha og sakit. So, what are the signs and symptoms of the syphilis? So, naay 4 stages ang syphilis: primary, secondary, latent, and then tertiary. So, each of stages has different signs and symptoms. So, first is the primary stage. So, during the first primary stage of syphilis, you may notice a single sore or multiple sore. The sore is the location where syphilis entered your body. These sores usually occur on or around the penis, vagina, anus, rectum, and lips or in the mouth. Sores are usually, but not always, firm, round, and painless. Because the sore is painless, you may not notice it. The sore usually lasts for 3 to 6 weeks and heals regardless of whatever you receive treatment. Even after the sore goes away, you must still receive treatment. This will stop your infection from moving to the secondary stage. So next is the secondary stage. So, secondary stage is, diri na siya is makakita na kag mga rashes or sore in your mouth or vagina or sa imuhang anus. So, kani nga stage, usually ga-start na ang rash on one or more areas of your body. So, kanang rashes is ga-show up when your primary sore is healing or several weeks after the sore has healed. So, kanang rash can be on the palm of your hand or at the bottom of your feet and look like rough red or reddish brown. So, the rash the rash usually won't itch. So dili siya magkatol. And it is sometimes so faint that you won't notice it. So other symptoms may include like fever, ilantan ka, swallowing plump glands, sore throat, patchy hair loss, headaches, weight loss, muscle ache, and fatigue, or feeling very tired. So the symptoms from this stage will go away whenever you receive treatment. Without the right treatment, your infection will move to the latent and possibly tertiary stage of syphilis. So next is the latent stage. So kanin sa latent stage is wala siya visible sign or symptoms. So kung walay treatment nga mahitabo ang syphilis is mag-continue sa imuhang body for years. So next is tertiary stage. So most people with untreated syphilis do not develop tertiary syphilis. However, when it does happen, it can affect many different organ system. These include the heart and blood vessels and the brain and nervous system. So if dili matreat ang imuhang or di maagapan ang pag di maagapan og treat imuhang syphilis, pwede siya maka-apekto sa imuhang mga organs like sa imuhang blood vessel, heart, o brain. So tertiary syphilis is very serious and will occur for 10 to 30 years after your infection began. So in tertiary syphilis, the disease damage your internal organs and can result in death. So if dili siya maagapan, pwede nimo siya ikamatay. Healthcare provider can usually diagnose tertiary syphilis with the help of multiple tests. So what is scabies? Scabies is not an infection but an infestation. Tiny mites called sarcoptic scabies set up shop in the outer layer of human skin. So, ang scabies is naa siya sa imuhang outer layer sa imong skin. The skin does not take kindly to the invention as the mates burrow lay eggs inside the skin. The infestation leads to relentless itching and an angry rash. So, scabies symptoms. So, when a person infested with scabies for the first time, it can take 4 to 6 weeks for the skins to react. So, if ang person nga naay scabies nga for the first time is dili pa nila na sila maramdaman, like mga before pa mga 4 to 6 weeks pa nila ay ilahang skin mo react. So the most common symptoms are intense itching, especially sa gabi, like a pimple-like rash, scales or blisters, or sores caused by scratching. So how does scabies spread? So scabies typically spread through prolonged skin-to-skin contact that gives the mates time to crawl from one person to another. So for example, like naghinulumanay mo og like personal item such as like towel, beading, or so what etc. So scabies can pass easily between family member or sexual partner. It is not likely to spread through a quick handshake or hug. Scabies mate can jump or fly and crawl very slowly. So ang scabies dili siya like galupad or ga-jump. So like di po siya mapasa like sa like hugging lang ana, like handshake. So ayha lang siya mapasa if naghinulumanay mo og like mga object like towels. So anyone who gets scabies. So anyone can get scabies but does not higher risk include. So tanan makakuha og scabies, but ang mga higher risk is katong naay sexually active adults, prison inmates, people living in grounded condition, people in childcare facilities. So, mao to siya like katong ang makakuha ni is katong na siya sa mga crowded or kana bitong mga mga or daghan mo sa inyong balay like ana good like mga crowded nga mga lugar mo na siya makakuha ka diha. So so next is the HIV. So HIV is a human immunodeficiency virus. It's a virus that attacks the body immune system. If HIV is not treated, it can lead to AIDS acquired immune deficiency syndrome. So, ang HIV is if dili nimo siya ma-treated, pwede na siya or pwede siya ma-lead to AIDS or acquired immune deficiency syndrome. So, there are currently no effective cure once people get HIV. So, wala pa'y cure or wala pa'y gamot para para mawala ang HIV. So, but with the proper medical care, HIV can be controlled. So, people with HIV who get effective HIV treatment can live long, healthy lives and protect their partner. So, where did HIV came from? So, HIV infection in humans came from a type of chimpanzee in Central Africa. Studies shows that HIV may have jumped from chimpanzee to humans as far back as the late 80s. So, ang HIV is gikan siya sa hayop or sa chimpanzee nga napasa sa tao. So, kaniday ang HIV is so una pa din ni siya like 80s pa din ni siya. So the chimpanzee version of the virus is called simian immunodeficiency virus. It was probably passed to human when humans hunted these chimpanzees for meat and came in contact with their infected blood. So napasa ni siya sa humans tung ano daw like gihunting daw nila ning chimpanzee nga naay dala nga infection nga like gikaon nila. So tung blood sa chimpanzee is or tung blood sa chimpanzee is na so gikaon di ba nila ang chimpanzee or so tung infection nga nasa chimpanzee is napasa sa mga tao. So sa human. So over decades, HIV slowly spread across Africa and later to other parts of the world. The virus has existed in the United States since at least in the mid of 1970s. So dugay na diay gyud ni siyang HIV, di ba? So nagsugod ni siya sa Africa and then later on is nagkalat na din siya sa around the world. So, what are the stages of HIV? So, when people with HIV don't get treatment, they typically progress through 3 stages. So, na 3 stages ang HIV. But HIV treatment can slow or prevent progression of the diseases. With advance in HIV treatment, progression to stage 3 or AIDS is less common today than in the early years of HIV. So the stages is the first stage is the acute HIV infection. It is people have a large amount of HIV in their blood and are very continuous. So many people have a flu-like symptoms. If you have flu-like symptoms and think you may have been exposed to HIV, so you should get tested. So If na may mga symptoms nga ay wait. So, next is the stage 2 or chronic HIV infection. So, this stage is also called asymptomatic HIV infection or clinical latency. So, HIV is still active and continues to reproduce in the body. People may not have any symptoms or get sick during this phase but can transmit HIV. People who take HIV treatment as prescribed may never move into stage 3 or AIDS. So without HIV treatment, this stage may last a decade or longer or may progress faster. At the end of this stage, the amount of HIV in the blood or viral load goes up and the person may move into stage 3 or AIDS. So next is the stage 3, the acquired immunodeficiency syndrome or AIDS. So this is the most severe stage of HIV infection. Most people with AIDS can have high viral load and may easily transmit HIV to others. So if naka sa stage nga sa AIDS, so dili na lang kay ka makapasa og HIV sa lahi nga tao. People with AIDS have badly damaged immune system. They can get increasing number of opportunistic infection or other serious illness. So dali na lang sila pasahan og sakit kay hina naman ilahang immune system. So without HIV treatment, people with AIDS typically survive about 3 years. So if walay tarong nga treatment ang AIDS patient, so maglast na lang sila or makasurvive na lang sila about mga 3 years na lang. So naabay cure ang HIV? Ang answer is no. Wala pa'y cure ang HIV. But you can control it with HIV treatment. So most people can get the virus under the control within 6 months. HIV treatment does not prevent the transmission of other sexually transmitted disease. So, yeah. Thank you.
Contraceptives. So first, let us define what is contraceptives. So contraceptives is defined as the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drugs, or surgical procedures. So under the contraceptives part, there are 10 types of contraceptives. So first is oral contraceptive. So what is oral contraceptive? It is also known as the birth control pill, any of class of synthetic steroid hormones that suppress the release of follicle stimulating hormone or FSH and luteinizing hormone or LH from the anterior lobe of the pituitary gland in the female body. So what unsa ang ginamit sa contraceptive or oral contraceptive? So ang oral contraceptive kay isa siya sa kuan sa birth control pills nga ang hormone containing medications that are taken by mouth to prevent pregnancy. So isa ni siya sa type sa mga contraceptive nga maka-prevent og pregnant sa isa ka bae. So ang naay mga common examples sa oral contraceptives which is ang Apre, Avian, o katong microgestin FE tapos Sprintic mga ingana gakakuan ni siya sa mga butika, mga pharmacy ana. So next to oral contraceptive is the transdermal patch or the patch. So transdermal patch is the birth control patch is a type of contraception that contains the hormones estrogen and progestin. You wear the patch to avoid becoming pregnant. So ang nawong aning transdermal patch is mura siya gamay nga square nga ginapilit sa panit. So next is the vaginal ring or the Nova ring. Kani siya kay gamay na nga plastic ring nga i-place sa sulod sa vagina or sa sa vagina. So ga-release din ni siya og continuous dose of hormones like estrogen and progesterone into the bloodstream to prevent pregnancy. So asay ay kung sa transdermal patch is kanang sa gawas lang siya, sa panit lang siya ibutang, ang vaginal ring is isulod gid siya sa vagina sa isa ka babae para maka-prevent og pregnancy. So next is hormonal injection. So katong kaganina nga mga nabanggit nako or na state nako, ang mga meaning nila is sa gawas pa lang ang sakuan ang katong sa transdermal patch, and then ang katong sa vaginal ring is katong isulod siya sa vagina, and then ang hormonal injection is gina-inject na siya, so is steadily releases the hormone progestogen into your bloodstream, which prevents the release of an egg each month or the ovulation. So ang pinaka the best nga example ani is ang Dipo, or ambot kung nakadungog na mo ani, basta kay gakakuha na siya sa mga center ana, kadunggan ba ninyo sa iyong mga mama nga nabanggit niya ana. What is Dipo? So Dipo is a well-known brand name for medroxyprogesterone acetate, a contraceptive injection that contains the hormone progestin. So Depo-Provera typically suppresses ovulation, keeping your ovaries from releasing an egg. So basta common ni siya gakadunggan is kanang sa mga center or kana bitang nay mga babae nga magpadipo para sa dili sila maburos ana. So next is the cervical cup. Cervical cup yang dagway ani or ang shape ni ani is kay mura siya gamay nga kana bitang cup. So cervical cup is a small cup made of silicone that fits over the cervix, or cervix kay the part of the uterus that opens into the vagina, and then it covers the cervix so that the sperm can't get in and fertilize the egg. So isa siya po ni siya sa way nga dili siya po makakuan, dili ma-fertilize ang egg and dili maburos ang isa ka babae. So mura ni siya kuan nga cup, gamay lang gid siya kayo nga cup nga murag kuan kaning made siya sa silicone. So next is diaphragm contraceptive cup. So kaganina kung ang cervical cup kay small cup made of silicone, ang diaphragm is a contraceptive diaphragm, or a cup is a circular dome na iyang shape made of thin soft silicone. So ang kapares nila is silicone sila made duha, pero ang kalayan po nila is ang cervical cup kay small, tapos ang diaphragm contraceptive cup kay pabilog siya, that is inserted into the vagina before sex. So kani siya pon siya gina-insert siya para maka-prevent siya pon og pregnancy. So it covers the cervix so sperm cannot get into the womb or uterus to fertilize egg. So ilang role duha is maka-prevent siya pon para dili ma-fertilize ang egg. So next is the surgical method. So surgical method operation is which involves the tying and cutting of the fallopian tubes in order to prevent the egg released by the ovary being fertilized by the sperm. So kani siya is kuan na gid siya kaning murag surgery na ang gamiton para ikat imo ang fallopian tube para dili ka maburos. So let's proceed to male condoms. So male condoms, let's define what is male condoms. So male condoms are a barrier method of contraception. They are made of a very thin latex or rubber. Kanang gikan sila sa rubber nga polyurethane or polyisoprene. Kaning kuan siya, and are designed to prevent pregnancy by stopping sperm from meeting an egg. So mo ni siya ang ginagamit sa kanang aside sa katong mga cervical cup, mainga na kani po siya ang isa nga ginagamit para maka-prevent pud siya nga dili maburos or dili kuan ang ginastop niya ang sperm ma-meet ang egg para dili ma-fertilize, para dili maburos ang isa ka girl. So kuan man siguro ni siya, or so open-mindedly speaking, kani siya is kanang murag common naman kani sa ato gakadunggan nato, and then gakapalit po ni siya sa mga pharmacy mahing ana. So ang condoms pod kay makaprotect pod siya against STIs kanang if used correctly during the vaginal, oral, and anal sex. So male condoms kay kuan siya is a thin cover worn on the penis during the intercourse. Using a condom will help prevent female partners from becoming pregnant. So So, ang condom or male condoms kay makaprevent siya sa female partners from becoming pregnant. Ang ang male condoms is kuan daw kaning nipis lang daw ni siya, nigpis siya, so dali ra gid ni siya kanang murag kana bitang magisi kung dili tarong imong paggamit or pagplastar. Then, according to sa akong na-research is male condoms is a thin cover worn on the penis during the sexual intercourse. So, kato siya na siya proper proper way nga kanang para dili siya magisi kay kung magisi na siya automatically ang imong partner, ang female partner nimo is maburos na gid dayon siya. So before we proceed to the female condoms, let's tackle about what country invented condoms or who invented condoms. So some contest that it was by Charles Goodyear in America 1839. So pero ang unpatented in 1844, pero others accounts claim that it is Thomas Hancock in Britain in 1843. So the first rubber condoms was produced in 1855, and by the late 1850s, several major rubber companies were mass producing other items rubber condoms. So ang uban gina-claim nila nga si kuan gyud si Thomas Hancock sa Britain, siya daw ang nag-invent sa condoms, pero most people or most nga mga person kay ang gina-claim gid nga nag-invent sa condoms or sa rubberized condom is si Charles Goodyear gyud sa America. So which is akong gibasa is una man pod na claim ni Charles Goodyear sa America tong 1839. So pero wala pay confirmation kung kinsa gid sa ilahan duha. So next is kung naay male condoms is napoy female condoms. So or the internal condoms. So female condoms are barrier method of contraception worn inside the vagina. So they prevent pregnancy by stopping sperm meeting an egg. So same sila og roles atong sa male condoms. So gina-prevent Japon niya or gina-stop Japon niya ang sperm ug ang egg nga mag-meet para dili pregnant. So, a female condom can be put into the vagina before sex, but make sure the penis does not come into contact with the vagina before the condom has put in. So, ang female condom kay kanang siya, ibutang siya daan or isulod siya daan sa vagina sa girl para before ang sex para tapos kanang i-make sure po din siya nga dili sa mag-contact ang penis and vagina kay naay possibility nga kanang makuan pa ang sperm. Dapat dili sa sila mag-contact kay naay possibility nga is kanang naay possibility nga makuan sa vagina sa girl and then maburos dayon siya. So kailangan siya mabutang before mag-sex and dili siya mag-contact ang penis og ang vagina kay Andre, but make sure the penis does not come into contact with the vagina before the condoms has put in. So there are two types of female condoms, the FCI and the FC2. So ang external condoms or also known as the male condoms. Tapos, ang sa babae din is internal condom. So, ang dental dams din kay placed over the genital for oral sex. So, mana siya. So, lastly is, what is the difference between female condom and a male condom? So, ang difference nila is that with a female condom is the woman inserts this, so gina-insert niya into the vagina rather than the man wearing the condom. So ang katong sa female condom is kanang ginasulod siya sa vagina sa girl, and then while ang male condoms kay ginasuot siya, as is the case with a female condom. So in addition, ang female condoms kay often more expensive to buy than the male condoms at maybe harder to find. So, ang kaning female condoms kay lisod pud siya pangitaon kaysa sa male condoms. Tapos mas mahal siya og lisod pangitaon. Mao ni sila ang difference nila, but ilahang similarity pod is kanang same ra sila nga rubberized. So mao na siya. Hope you understand, guys. Thank you.